Becoming a mother is one of the most phenomenal events in a woman's life. Nothing gives her more joy than holding her baby in her arms. But for some women, it is a challenging time to become a mother during ongoing outbreak of coronavirus pandemic. Fear, anxiety, and feeling of uncertainty have gripped them during this otherwise happy time, and yet they have handled the situation gracefully. We at Medicircle present National Safe Motherhood Day Awareness Series, where we are featuring successful mompreneurs, healthcare professionals, obstetricians, and gynecologists, entrepreneurs working on safe motherhood to raise awareness about adequate access to care during pregnancy, childbirth, and postnatal services. Hello, I'm Sana Khan, and today our guest for the talk is Dr. Nupur Gupta. Dr. Nupur is a consultant gynecologist and obstetrician and is the Director of Obstetrics and Gynecology at Fortis Healthcare, Gurgaon. She is also the founder of Dr. Nupur's Well Women Clinic. She has published numerous journal articles, book chapters, and is continuing medical education series in newspapers and magazines. Please welcome Dr. Nupur to Medicircle. Hello, Dr. Nupur, how are you?
Thank you, Sana, for the invitation.
Okay, ma'am, the 6 pillars of safe motherhood include family planning, antenatal care, obstetric care, postnatal care, postpartum care, and control of STI, HIV/AIDS. In your view, how can we ensure safe motherhood?
Yes, thank you, Sana. So, safe motherhood encompasses lot of components,
Right.
starting from pre-pregnancy, during pregnancy, postpartum, and also post-abortal care is part of the same treatment that women would like to seek. And in another term, safe motherhood means the quality care the women
Right.
need, the access to care the women need during such times, whether they are in rural India or whether they are in urban,
Urban.
they are part of the urban population, but the high quality care that they need at this time is termed as safe motherhood. And mothers have the right to have this safety and right to have access to safe abortion and access to motherhood care at this
Mhm.
time in hospital with the doctor and especially an institutional delivery. So all these components keeping in mind are very essential to give the adequate antenatal care that women need. And for the same reason, the Safe Motherhood Day is celebrated every year from 2003, which is also the birthday of Kasturba Gandhi.
Super Gandhi.
And it is only to create awareness around this. And it also encompasses newborn care and breastfeeding and also the psychological support that mothers need post delivery. And I think everyone, obstetricians, even the healthcare workers from other departments and government is working hard to improve the motherhood services in India. Now we also have dedicated mother and child hospitals to give the same care. We are also working on increasing our institutional deliveries
Mhm.
so that any complication related to maternal and child health can be taken care of or may be identified at an earlier time. So to be able to give good quality care during pregnancy and to avoid and handle these complications in a better way, what is important is to have a preconception checkup. So whenever any reproductive age female is planning for a baby or is getting married, that is the best time in the preconception period to have a visit to a gynecologist to screen for non-communicable diseases, to screen for hypertension, to screen for diabetes, or to
Mhm.
screen for any other viral infection. Nowadays, we also do screening for thalassemia to be able to identify before uh, before you plan your pregnancy.
Correct.
So adequate measures can be adopted. So prenatal care or preconception care is one part.
Mhm.
Secondly, it is antenatal care that they need during pregnancy. So in 9 months pregnancy till 28 weeks, every 4 weeks is mandatory. From 28 to 36 weeks, it is 2 weekly checkup, and from 36 weeks till delivery, it is the weekly care that they need.
Ji.
But during the last 1 year, our main focus is only to prevent and minimize infection to mothers due to this COVID-19. and to offer them protection and adequate accessible care which they need during this time. And our main focus is to reduce the morbidity and mortality that is
Mm.
associated with pregnancy and childbirth. So other than preconception care, the pregnancy care, or what we call antenatal care, which is essential. Women who are in urban areas can go for antenatal classes to better know about their sign and symptoms. They can go for teleconsultations. We can
Right.
make a birth plan for them, what will be their mode of delivery. They
Mm.
can go for regular vaccinations that are mandatory in pregnancy.
Mm.
We should also be able to screen the high risk mothers who have any other medical illness, which can be kidney, which can be liver, it can be
Right.
hypertension, diabetes, and give them education about breastfeeding and newborn care during these times.
Mhm.
Another thing, what we would like to advise them is to be fearless. Whatever it is, we are there to look after them. Yeah.
Dr. Nupur, each year in India, roughly 30 million women experience pregnancy and 26 million have a live birth. With an estimated 45,000 deaths per annum, India contributes to a majority of the maternal mortality burden. What are the major causes and how do we prevent from it?
Yes. So India accounts for a large burden of maternal mortality and morbidity that the
Ji.
world looks at. And
Mhm.
one of the main reasons is illiteracy, and also a
Ji.
lot of rural population that we have and who have do not have enough access to antenatal care. But there are some things which can be managed. Number one, screening for anemia. So any woman who is getting married, who is planning pregnancy, we should be able to screen for anemia.
Yeah.
We should be able to screen for hypertension, to screen for diabetes, so that such complications can be avoided. And some complications that happen during pregnancy are due to hypertension, that is preeclampsia and eclampsia. They throw fits during pregnancy because of the pregnancy changes that they
Ji.
undergo. They have chances to develop pregnancy induced diabetes, especially
Okay.
women who have polycystic ovaries or who
Mm.
have a family history, so we can screen them. Another risk factor is sepsis, that is infection that they have, which
Right.
is sometimes due to unsafe abortions, and also sometimes due to not be able to go to the right facility, or
Mm.
when they have home deliveries.
Right.
Also, some lot of women deliver at home or in small centers where they are not able to screen the high risk women, and they are not able to identify at the right time when should they be referred to a higher center, so that we can reduce their morbidity and mortality. Uh, so the problems that happen is at three levels. One is delay in identifying that they need to be referred to a higher center.
Right.
Second is the delay or the time that is required to reach the right facility. And
Mm.
thirdly, the transport, which should be available at the right time. So, but lot of ANMs, lot of ASHA workers are being given education to be able to identify those high risk women and to be able to refer. Now we also have machines, and the technology has advanced. There are apps that can be installed in government centers and small PHCs where they will be filling all details. There are photographs to monitor labor so that labor complications can be identified at the right time. They are referred to facilities where they can be offered cesarean at the right
Okay.
time so that morbidity to mother and newborn can be reduced, as well as facility for blood transfusion, because
Okay.
sometimes blood loss due to antepartum hemorrhage, that is bleeding during pregnancy, or postpartum hemorrhage after delivery also contributes to maternal death many a times, and these can be avoidable.
So, Dr. Nupur, what precautions pregnant women should take during COVID-19, the time that we are facing right now, currently?
Yes, Sana, this is a difficult time for expectant mothers who are planning, as well as who have already conceived and are planning to give birth during these times. It has
Mhm.
come as a horror in their lives, and they are facing a tough challenge, especially this invisible enemy. And no matter they don't move out from their house, but someone or the other person has to move out either for work or for essential requirement or whatever may be the need. But our advice for pregnant women is to stay at home as far as possible. In
Mm.
even if they are working, they should opt for work from home facility.
Right.
Invite as less people at home and
Mhm.
not go out for any function, either family function or any gathering outside during such times. And this
Least
is
social
recommendation
contacts.
also, yeah, least social. And this is also recommendation by Government of India. But
Okay.
very important is to take their vaccinations, to go for
Okay.
their regular ultrasound, and physical visit as advised by the doctor uh, should be mandatory, and that should not be missed.
Okay.
And they should be able to identify, yes, that what are the high risk warning signs they should keep in mind, that
Mhm.
they need to visit the doctor. We have also been able to guide them about the high risk and the warning signs at home. They are able to monitor their weight and blood pressure. Women who are diabetic are monitoring through the glucometers that have been given to them.
Right.
Dietary management has been offered
Okay.
online. And yes, online has its own limitations, but most of them are trying to go for teleconsultations,
Right.
especially in urban areas. But rural area is still facing a very big
Right.
challenge.
Ji.
And pregnancy itself is a very big high risk factor to acquire infection. So it is also important for them to take their regular vaccinations, including the flu shot, because
Okay.
flu pneumonia is very common in pregnancy. Need for hospitalization is higher, and sometimes even ICU admission.
Oh,
And now, last 1 year, we have seen that COVID infection in pregnancy also is more serious than other people. They need they need more admission in hospital, more
mm,
chances of pneumonia, ICU, being on ventilator, also increasing their morbidity and mortality.
right.
Women are also going into premature labor. Even some
Okay.
are showing stillbirths, that baby is not alive.
Okay.
Although vertical transmission, that is from mother to baby, the risk is not very high, not very, there is not enough data that shows that infants or newborns are infected with positive mothers. But
Okay.
yes, they need to take care in the postpartum
True.
period, although we still recommend them to breastfeed after taking all the precautions.
Right.
In US and UK, now the pregnancy vaccination is also underway. So pregnant women are taking the COVID
COVID
vaccination
vaccinations.
to give them protection, and that leads to formation of antibodies that not only protects mother but is also transferred from placenta to the baby. So
Okay.
baby also gets some kind of protection. In India, we still don't have that facility, and our government has not yet approved COVID vaccine for pregnant women till date. But yes, for all pregnant women, you should also not ignore any sign and symptom like fever, like sore throat, or maybe loss of taste or
Right.
loss of smell,
Right.
and any other feature which you did not have during these times, and go for the test at the right time so that we are able to diagnose and
Mm.
treat you early and you don't land up in complications. Although 95% of pregnant women will have only mild symptoms, it is
Okay.
only those 5%, but we need to identify at the right time if we are able to test and identify.
Right. Dr. Nupur, what are some warning signs during pregnancy that a woman should not neglect and immediately report to her gynacs?
Yes, so warning signs any pregnant woman should know, and it is based in every trimester. So, one
Right.
of the warning signs is bleeding in pregnancy, which is very common.
Okay.
Sometimes, after conceiving, also they have irregular bleeding. So, we need to identify ectopic pregnancy, where pregnancy is in the tube. Is it at a
Okay.
location which is outside the uterus, which can be life threatening? So, first and foremost is that. Second is bleeding in any trimester. In first trimester,
Okay.
it creates a risk of threatened abortion that she might abort.
Mm-hmm.
In the and but in initial stages of pregnancy, sometimes bleeding can be sign of implantation also, but
Okay.
that will subside in some time.
Mm-hmm.
Bleeding is also poses a risk to premature delivery, and it can be either due to low-lying placenta, that is placenta previa, or placenta which is getting separated before delivery, which is called
Right.
abruptio placenta.
Okay.
So this risk comes during the second and third trimester, and there are chances that they might deliver before before the scheduled time, that is
Okay.
preterm delivery, which will lead to even the newborn morbidity, and
Okay.
newborn needs to stay in nursery, that is the neonatal care unit, for
Right.
a longer time. So
Okay.
bleeding should never be ignored. Any kind of bleeding, whether it
Hmm.
is brownish discharge or whether it is fresh blood, and they should be in touch with their obstetrician.
Okay.
Bleeding can also happen naturally. Why? Because the lower part of uterus, which is called cervix, that becomes more vascular, and it
Okay.
can spontaneously sometimes bleed.
Mhm.
There can be a polyp or a fibroid polyp that can bleed. So sometimes we also do a pap smear and a local examination to check for local causes. Sometimes women also have been reported to have cervical cancer during pregnancy, which is the
Okay.
cause for bleeding, or even cervical tuberculosis leads to bleeding in pregnancy,
Okay.
but no bleeding should be ignored.
Hmm.
And report to the doctor immediately. And sometimes when the baby is dead inside the uterus, the
Hmm.
mother can also show signs of bleeding. The
Okay.
second thing which they should keep in mind is pain abdomen. So
Okay.
pain abdomen has multiple reasons during pregnancy. It can be due to bloating, it can be due to your constipation, or sometimes loose motions, or inability to digest what you are eating.
Right.
Sometimes proteins they are not able to digest, sometimes fats and carbohydrates, or depends on you are eating oily, spicy food will also lead
Hmm.
to pain abdomen. And even urine infection is common during
Right.
pregnancy, which also is a cause for pain. But what we don't need to ignore is that we have to rule out it is labor pain or it is a
Right.
sign of threatened abortion. So any
Right.
pregnancy that is aborting can also come to us as pain abdomen.
Okay.
So, and third thing is the passage of water per vaginum, that
Right.
is leakage. So, leaking membranes and wetting of clothes, which can
Okay.
happen also in second trimester or in third trimester, but it is a sign of delivery. Or the
Okay.
baby can abort in second, maybe around 20 weeks, which we call it as abortion, or
Right.
maybe after that, which is leading to premature delivery. So sometimes membrane rupture before time. So bleeding, pain, leaking of membranes, this should never be ignored. Sometimes there are signs of other medical illnesses like
Right.
hypertension.
Hmm.
Hypertension can have severe headache, epigastric pain, blurring
Okay.
of vision, or sometimes a woman can also throw a fit at home, is
Okay.
a sign of eclampsia during pregnancy or maybe after delivery. Sometimes excessive stress can also produce such kind of symptoms, but that need to be monitored. So during
Right.
these times, we ask them to monitor blood pressure at home so that we are able to diagnose. Even diabetic complications are much higher in pregnancy. The risk of stroke is much higher in pregnancy.
Right.
Any complication or any pre-existing illness that you might have will be aggravated during pregnancy.
During pregnancy.
Sometimes there is risk of thrombosis is higher, thromboembolism is higher. So
Okay.
that needs to be kept in mind. So obstetrical emergencies, for them, the hospital is always open, the emergency care is always available, and they will never be denied treatment in any center which takes care of pregnant women, and their access is available round the clock.
Right. India is one of the most high risk places in the world to give birth, accounting for 15% of total maternal deaths worldwide. Every year, 44,000 women die in India due to improper care during pregnancy. As a dedicated healthcare media platform, through this initiative, we hope we are able to educate and aware people about safe motherhood. Thank you so much, Dr. Nupur, for taking out your valuable time and giving us such significant and important information about safe motherhood. And we are really pleasures to have you on the show. Thank you so much for coming.
Thank you, Sana, and thank you, Medicircle, for creating this platform so you are able to reach masses and educate as many women, as many families as possible through this platform. Thank you.
Thank you so much, ma'am. Thank you so much. Take care. Have a good day.